Ladies and gentlemen, I welcome you all to today's session on reimagining health workforce development in Africa, critical for Africa's health security. We are holding this side event in the margins of the 77th UN General Assembly at a time when we have experienced a lot of challenges during the pandemic. And the generosity of African countries during this time will hopefully one day be properly documented to show how Africa came together during this difficult time and worked through the pandemic to successfully keep the numbers down, to successfully ensure that our health systems continue to work, not just during, but also after the pandemic. We expect some resilience. I would like to invite His Excellency Minister Joe Fowler to give the message from His Excellency the President of South Africa, who are our hosts for this side event today. Minister Fowler, you have the floor.
Thank you very much, Honorable Chairperson of meeting, our Acting Director General, CDC, Dr. Ahmed Ugweli, to greetings to Excellency, the Chair of the AU Commission, the Musa Faki Mohammed. Greetings also to Your Excellency, the former President of Liberia, Madam Ellen Johnson Sirleaf. All other ministers present, I saw my colleague, the Minister of Health of Ethiopia, all other dignitaries, heads of state and representatives of heads of state, heads of government, partners, and all other officials and esteemed speakers. As indicated by the chair of the meeting who opened the meeting, I bring to you very kind and fond regards from President, Excellency President Ramaphosa, who is apologizing for not being able to be here due to other commitments. So whatever I'll be saying here, please keep in mind that when I say I, it's not myself as South African Minister of Health. I'll be speaking on behalf of Excellency President. President Ramaphosa says, I'm delighted that we have created this opportunity to come together as partners in the quest for a capable workforce that can deliver universal health coverage for Africa. He says, I believe that the theme for this year's general debate, which is a watershed moment, transformative solutions to interlocking changes, close quote, it's poignant for this side event that has brought us together here. Whilst COVID-19 is still in our midst, we have developed tools and strategies to be able to live with the virus and resume all our social and economic activities. However, the theme reminds us that we cannot go back to business as usual. We must be acutely aware of the transitional state of affairs and have the political, moral, and business acumen to tackle the transformative elements needed to regain our path towards sustainable development goals. The AU's new public health order shines a spotlight on health workforce development as an enabler towards attaining the SDG 3 in terms of universal health coverage Indeed, COVID-19 and other devastating pandemics like HIV and Ebola have taught us that failure to invest adequately in the health workforce has dire social and economic consequences. As we navigated the COVID-19, the world lost an estimated 180,000 health workers to this pandemic, and we continue to lose millions more to resignations. According to the Forbes magazine, some reports estimate a 20% overall loss, including 30% of which being 30% loss of nursing staff. All over the world, the healthcare systems are struggling to recover as the great exodus of exhausted and emotionally depleted health workers puts greater pressure on government to deliver services to a population that harbors a growing pandemic of other diseases, especially non-communicable disease. Health workers are a crucial pillar in a well-functioning health system, yet they've been historically deprioritized in discussions pertaining to the improvement of our health systems. Despite having 25% of the world's health burden, the WHO estimates that Africa has only 1.3% of the world's well-trained health personnel. Africa had an average of 1.30 health workers per thousand population in 2015, significantly less than the 4.5 per thousand needed to meet the SDG goals. Though gains have been made, Africa has the most severe health personnel shortfall, predicted to reach 6.1 million by 2030 out of the anticipated global health staff needed of 4.5 million shortfall, which is required to attain the universal health coverage. So a huge shortfall instead of 14.5 million by 2030, it's estimated that we will only have 6.1 million workforce. It is good economics to invest in health workforce as the return on investment is measurable and dependable. The Organization for Economic Cooperation and Development and the International Labour Organization has shown that on average, health workforce investment generate a return on investment of 9 to 1. So out of, if you invest $1, you get a return of approximately 9. The Uganda Bureau of Statistics in 2019 reported an impressive 51 to 1 return on investment over 30 years. In addition, when one considers that 70% of women